Hi, everyone. It's Dr. Ryan Shelton. I am a functional medicine doctor for My Go To Doc. Happy Tuesday. Welcome. Salutations. Today's topic is going to be on the functional medicine approach to chronic fatigue syndrome. Now, why am I choosing chronic fatigue syndrome? Many of the doctors at My Go To Doc specialize in post COVID infection and post vax reactions. Now, before COVID came along, chronic fatigue syndrome was the closest thing that we had to long haul COVID symptoms. Now, I want to make it absolutely clear I am not equating post COVID long haul symptoms with chronic fatigue. However, they do share many similarities. They share brain fog, they share fatigue, they share pain. In fact, they share many of the underlying physiological processes that we see post COVID infection, like microclotting, a dysregulation of the hormonal system, specifically the HPA axis. So it's an interesting foray for me to consider how I treat chronic fatigue syndrome and how well it actually relates from a functional medicine standpoint to long haul COVID symptoms. So we're just going to get into the definition of chronic fatigue, maybe the causes or at least the known contributing factors, the effective treatments, and then we're going to talk about some of the similarities between chronic fatigue and post-COVID long haul symptoms as well. So I'm going to cover about 25 minutes of material. And as always, I am wide open to questions, anything that you want to ask about functional medicine. I hope that we keep it to the topic of chronic fatigue and some of the similarities that we see with chronic fatigue and post COVID infection. Um, but any question that you might have about supplements, about vitamins, about lab testing with functional medicine, please let me know. And I will certainly reserve time at the end to get to most, probably not all, of the questions. So, chronic fatigue syndrome, it's a chronic illness. Now, that's important. It's a chronic illness. It's not a few days or even a couple of weeks of fatigue. That can be related to a number of other issues, but it's a chronic illness characterized by severe fatigue. So, an inability to sustain activities of daily living on an effective level. Difficulty thinking clearly, so we colloquially will call this brain fog, and pain. Chronic pain throughout the body. It's mostly in the joints and muscles, although it can manifest other ways, such as headaches or neuropathies as well. Chronic fatigue syndrome is actually fairly common. It's estimated that about 1 in 100 people may be affected by chronic fatigue syndrome. Many people do not go to the doctor for it because they feel like nothing can be done. They feel like they will not be heard. They feel like they will be dismissed. And that is also a similar scenario. That's a similarity that it shares in common with long haul COVID symptoms. A lot of patients don't end up going to their doctor because they feel like they won't be believed or they will be dismissed or that there's no treatment for it. Maybe they're embarrassed. Maybe their doctor knows nothing about it. So that's certainly a similarity that it shares with chronic fatigue syndrome. And I want to start by saying there is hope, there is treatment. And as long as you work with a provider that has some experience in your particular case, you can go far down the path of achieving better health and wellness, visualizing better health and wellness. And it starts with lifestyle and diet, each and every case. So, making sure that your stress is under control, making sure that you're not overexerting yourself, getting adequate amounts of sleep, hydration, detoxification, and supporting the overall systems such as digestive health, immune health, and those pesky inflammatory markers that we'll get to in a little bit. So, the symptoms of chronic fatigue syndrome can be somewhat unpredictable and it varies from one patient to the next. also similar to long haul COVID patients. So, severe fatigue that does not improve with rest, sleep disturbances, brain fog or difficulty thinking, pain, dizziness, especially after standing up. Sometimes that's related to another condition called POTS. Gastrointestinal discomfort and dysregulation is also very common in chronic fatigue syndrome and post COVID infection patients. So it does share a number of similarities, and we'll get to some of the more chemical or physiological similarities here in a little bit. So chronic fatigue syndrome is a diagnosis of rule out. There's no definitive diagnostic test for chronic fatigue syndrome. If you go to your regular doctor, there's no test necessarily that you could request to definitively diagnose chronic fatigue syndrome. Also, sharing a similarity to post COVID infection or post vax uh, reactions. So, diagnosis is mainly centered on identifying the characteristic signs and symptoms after ruling out other known medical conditions. The most common ones being hypothyroidism, anemia, autoimmune disease, and even cancer. So, medical conditions must be ruled out. Okay, there's nothing behind the screen, nothing to see there in terms of a known diagnostic condition. They have all of the classic characteristics of chronic fatigue syndrome or post COVID infection syndrome. So that's the diagnosis that you received. Now, conventionally speaking, there's no definitive treatment for it. Some doctors prescribe antidepressant medications, anti-anxiety medications. Some patients prescribe hormonal therapy. They prescribe uh, they might prescribe corticosteroids to help with energy levels. They may prescribe sleep aids such as trazodone, benzodiazepines, antihistamines like Benadryl. They may prescribe cognitive stimulants like caffeine or uh, amphetamines such as Adderall or other stimulants. Some more advanced physicians may prescribe a class of herbal and natural agents called nootropics, which are known to help the brain function and to help with energy levels, adaptogens, which help the adrenal glands produce adequate amounts of hormones to help you deal with stress. And conventional treatments may also include anti-inflammatory or pain medications because that's very common. So NSAIDs, ibuprofen, muscle relaxants, cannabis has also been prescribed for chronic fatigue syndrome with moderate effect. And there are supplements that can be utilized for effective treatment of chronic fatigue syndrome. Again, it starts with diet and lifestyle, and we can add in certain supplements such as magnesium, L-carnitine, SAM, which is an acronym for S-adenosyl methionine, SAM. Probiotics have been helpful in the past. A combination of um, a specific kind of niacin called NMN and TMG. Sometimes it's prescribed simply as NAD plus. Those can be helpful primarily because of the assistance they provide for the mitochondria. And we'll get into the importance of treating the mitochondria both for chronic fatigue and post COVID infection here momentarily. Now, in terms of diet, it's very important that patients suffering from these conditions avoid ultra processed foods. So, artificial foods, processed sugars, basically anything in a package or a bag that's not a whole food, nutrient dense food, high in fruits and veggies, nuts and seeds, beans, legumes, whole grains, healthy proteins such as fatty fish and lean poultry, grass fed beef. And there are certain food categories that patients with chronic fatigue syndrome tend to be more sensitive to, including gluten, dairy, and they're certainly more sensitive to caffeine. So they tend to get bigger withdrawals from the caffeine, bigger crashes from the caffeine, and they are more negatively impacted by the consumption of alcohol as well. So, just some dietary cautionary advice for you. And again, it starts with lifestyle. So, diet and exercise, therapeutic movement. It's very important not to overexert yourself, either physically or mentally, because that tends to also decline energy levels and worsen brain fog and worsen pain. So, being very careful through physical activity and through mental activity not to overexert yourself. And most patients kind of get an idea of where that line is and they cross the line, and their day is terrible for the rest of the day. It includes also things like deep breathing exercise, meditation and mindfulness therapy, physical therapy, massage, acupuncture, neurofeedback, contrast hydrotherapy. All of those can stimulate the parasympathetic nervous system, which is required for chronic fatigue syndrome and also post COVID infectious syndrome. So again, the underlying cause is very poorly understood. However, let's talk about some similarities between chronic fatigue syndrome and post-COVID infection or even post-vax reactivity. So I want to break it down into kind of three broad categories. The first is something called cellular danger response. And so inside each and every cell is a essential organelle that's called the mitochondria. The mitochondria are essential for producing energy for each and every cell to thrive. And if cells are not thriving, tissues will not thrive well, systems will not thrive well, and you will not thrive well. And so many patients with chronic fatigue syndrome, when we do some further investigation, either through taking patient history or doing some more extensive functional medicine laboratory testing, we find that their mitochondria are are eliciting what's called a cellular danger response. You can Google it. CDR is sometimes what it's abbreviated. So we know that there's decreased energy for survival. We also know that with CDR, with poorly functioning mitochondria, there's hypercoagulation going on or microclotting going on. So in chronic fatigue patients, we see that. In post COVID patients, we see that as well. There's also an overactivation of mast cells. So mast cells activation, it's a syndrome that is quite common in post COVID patients, post vax patients, also chronic fatigue patients. So more times than not, it manifests on the skin. Mast cells increase the output of histamine. Histamine, we know, manifests mostly on the skin, or although it can also manifest in the respiratory tract, in the GI tract, and brain, causing mood disorders such as anxiety and depression. There are changes in cholesterol patterns in both chronic fatigue syndrome and in post COVID infection. There are changes in minerals, important minerals such as copper, zinc, and magnesium, which again, seen both in chronic fatigue patients and post COVID patients. There are lots of changes in bowels, so gas and bloating, more food sensitivities, leaky gut, constipation, diarrhea, dysbiosis. Again, in chronic fatigue patients and post COVID patients, there are changes in your immune system that make it more likely to develop autoimmune disease. So, chronic fatigue patients and post COVID patients, there's a shift in T cells that make it more likely that you will down the road develop some type of autoimmune condition because of the shift that occurs in the immune system. There's a change in vitamin D expression, again, both in chronic fatigue and post COVID patient. There's a change in B vitamin metabolism seen in both syndromes or conditions. And there's a change in methylation pattern, specifically in the mitochondria and this is largely why the NMN and TMG or NAD plus can be helpful, because it can help repair some of those methylation pathways as well as the B vitamins. So that's one, CDR, cellular danger response. Number two is the endocrine system, the hormonal system. There's a hypo-responsive HPA axis, there's a hyper-responsive SAM axis, and the vagus nerve, the parasympathetic nervous system, is understimulated. The sympathetic nervous system is overstimulated. So you're getting this chronic fight and flight flood of hormones through the system, and you can kind of think of it as an accelerator on a gas. If you're redlining your car constantly, you're going to break down that engine, and eventually it's just not going to run very effectively. And so these hormonal shifts that we see in the in the adrenal system, in the parasympathetic system, in the sympathetic system, we see similarly those changes both in chronic fatigue patients and post-COVID syndrome patients. And so cellular danger response, hormonal dysregulation, and third, but certainly not least, a change in inflammation and oxidative stress. And that leads to an overexcitation of immune cells. It leads to pain. It leads to fatigue. And the more oxidative stress that is going on in the body, by the way, you will age more quickly. So there are some functional tests that can be run to try to get a gauge on what might be going on from a functional standpoint. Again, there is no definitive diagnosis for chronic fatigue, but there are some tests that can be run. We can look at stool tests, we can look at urine tests, we can look at blood tests, looking for inflammatory markers, looking for the health of the digestive tract, looking for oxidative, reactive oxidative species. We can certainly look at the hormones, DHEA, cortisol, estradiol, progesterone, testosterone. Um, Sometimes a sleep study is important because sleep is so profoundly affected by chronic fatigue syndrome. They want nothing more but to sleep, but sleep is either unattainable, or if they do sleep, it's just unrefreshing for them. I got a ping here. Let me make sure I'm still on video. Yes, I am. Okay, sorry about that. And just to finish up testing, we can look at zinc levels, copper levels, vitamin D levels. We can look at inflammatory markers such as C-reactive protein, ESR, ferritin, fibrinogen. Looks at some of that microclotting. Hemoglobin A1C gives us a decent marker for inflammation as well. So again, what are the treatment options? Well, we do our best to support the mitochondria. So first, ensuring adequate protein intake each and every day. I recommend, so write this formula down. I recommend 0.8 grams per kilogram of healthy protein intake each and every day. For most people, that's going to come in the range of maybe 35 to 55 grams of protein each and every day. Protein is so important. Healthy protein intake is so important for chronic fatigue and post-COVID patients. Consider taking a good quality magnesium. I like magnesium L-threonate, magnesium glycinate or citrate are options as well. Acetyl L-carnitine is very nutritive and supportive to the mitochondria, as well as CoQ10. And CoQ10 does require a pretty decent dose. I would say a minimum dose of 100 milligrams a day. You can go as high as 300 milligrams a day. It's very well tolerated. The limiting factor with CoQ10 is usually cost, because a good quality CoQ10 is pretty expensive. I also like NAC or N-acetylcysteine for mitochondrial support. Glutathione is certainly an option if you can do a liposomal form orally or an IV glutathione. And alpha lipoic acid can be helpful as well. Of course, we want to support the oxidation that's going on. So antioxidants, very important. I like alpha lipoic acid for that purpose. CoQ10 is fantastic. NAC, glutathione, which we've already touched on, and then a couple of herbs that have great anti-inflammatory activity and are utilized for um, both chronic fatigue and post-COVID syndrome. Curcumin, a few herbs. Curcumin, ginger, and black seed are all great anti-inflammatory herbs. I like to throw in there quercetin and resveratrol as well. Acetyl L-carnitine is important. Also, carnosine can be an effective. It's kind of a metabolite of an amino acid, but carnosine can be helpful as well. And then, of course, we cannot forget about adaptogenic herbs. I like ashwagandha, also known as withania. Rhodiola has some pretty decent studies on it, spelled with an RHO. Rhodiola has some decent studies on it for chronic fatigue syndrome. Certainly, ginseng can be helpful. Eleutherococcus can be helpful. So, some of these adaptogenic herbs can really provide support for chronic fatigue syndrome patients. Um, I'm not a heavy prescriber of melatonin, but chronic fatigue syndrome is a case where temporarily this isn't something that I would necessarily prescribe for a patient for the rest of their lives, but temporarily just because the hormones are so dysregulated and melatonin is a sleep hormone and it's also the one of the most powerful antioxidants that the body produces naturally. The dose of melatonin really is variable between one person and the next. Some individuals do better on a low dose, so no more is not always uh, better. So some patients do better on a low dose of melatonin, 0.5 milligrams, so half a milligram at bedtime. Whereas some patients do better on higher doses of melatonin, 6, 7, 8, maybe as high as 10 milligrams of melatonin at bedtime. And again, it can help with sleep and it can help um, with some of those uh, reactive oxygenated species and those pro-inflammatory chemicals. And I cannot overemphasize the importance of stimulating the vagus nerve. You can Google the vagus nerve and learn about how to stimulate it. It's simple things that you can do on your own time, for the most part, for free, and it's whatever is relaxing and soothing to you. So this includes meditative breathing, deep breathing exercises, therapeutic movements like Tai Chi and yoga and Qigong are all effective. Yawning can be effective. Dancing, play with kids or grandkids, listening to music, and enjoying intimacy can also increase vagus nerve stimulation. And if you've seen me before, one of my favorite is contrast hydrotherapy, where you end your hot shower or bath with cold water for about 30 to 45 seconds, or you can certainly do a cold plunge as as well. So that's kind of my 20-25 minute version of an introduction to chronic fatigue syndrome. If you have questions about that, please let me know. I'm going to scroll over to this screen here and see if I can't answer some questions for us all. Okay. Let's see. Brain fog seems to be an ongoing issue for me. I only tried antihistamines for now. Okay. Is this the same as chronic fatigue syndrome? So, not necessarily. Brain fog in it by itself, while it's one of the characteristic symptoms of chronic fatigue, by itself, it wouldn't necessarily be diagnosed as chronic fatigue. If you've had COVID, it may be related more directly to the COVID than a separate issue of chronic fatigue syndrome. But certainly, brain fog or difficulty thinking that you're that is just in molasses and having a difficult time with memory and connecting the dots that you used to connect easy, and that might lead to irritability. So you've got brain fog, and your mental capacity just is not as it was, and a lot of people experience as a result of that irritability, lack of confidence, anxiety, depression, and so it can certainly directly affect mood. Brain fog. I don't know what I should try next. My diet is clean due to my liver problems, so the diet's good. Great. I feel my brain fog goes hand in hand with not being able to sleep, and yes, it certainly can. So making sure that there is appropriate sleep hygiene, making sure that your bedroom is comfortable and very dark, making sure that you're not engaging in screen time at least a half an hour before bedtime. Journaling is an activity that help people sleep, just so that you can write your thoughts down. Keep it on your nightstand. Write your thoughts down so those thoughts are not ruminating and circulating throughout the night. You've got them down in a safe place. They're there. You'll get to them in the morning. Taking a contrast hydrotherapy just before bed can be helpful as well to stimulate the vagus nerve, parasympathetic nervous system. Engaging in 10 or 15 minutes of deep breathing exercises. There are a lot of free apps available online that can help walk you through a 7, 10, 18-minute visualization of deep breathing exercises. Really helpful to relax the body, to relax the mind, and to help with sleep. You might be a candidate for melatonin if you haven't already tried that. And I would recommend maybe considering some adaptogens during the day. Don't take them too close to bedtime. They can be a little bit activating, which is good during the day for mental clarity. But not so good at night when you're trying to go to sleep. So Google these two words, and if you'd like more specifics, you can set up an appointment with me through our website, a functional medicine appointment. Adaptogens are wonderful, and nootropics. So that's Nootropics. So adaptogens, I would start with adaptogens, and then if you need to layer onto that some nootropics, that might be a good way forward for you. Let's see. Can the jab? You're from the UK. Can the jab cause an autoimmune reaction so severe that it will cause my dad to be constantly sick? Oh, you're asking for your dad. Okay, got it. Infection after infection with antibiotics and more antibiotics. Yes, it can. And so infection after infection with antibiotics and more antibiotics, advise him deeply to begin taking probiotics. He has to begin restoring his microbiome. It's been wiped out by chronic antibiotic use. And we know there is a very clear pathway between the gut and the microbiome and the brain. And if the microbiome is dysregulated, dissettled, then it can cause mood disorders like anxiety, depression, and certainly brain fog as well. And yes, getting jab after jab and taking antibiotic after antibiotic, it affects the microbiome, which affects your immune system, which will shift it towards being more likely to develop autoimmune condition long term. So consider really focusing on gut health for your dad. But yes, there is a connection to answer your question. Next question. I think I'm reading this correctly. The question is, what about leaky butt? I think you're referring to like diarrhea, maybe. If you're referring to leaky gut, that's something very different. That's a poor hyperpermeability of the intestinal lining. And so instead of those tight junctions in your small and large intestine being tight and only allowing what should go through food and vitamins and minerals, macro and micronutrients, if there's leaky gut, you have inflammation of the gut, and suddenly you're getting all sorts of fragments that should not be getting through the system, which just hyperactivates the immune system, which causes inflammation and pain throughout the body. However, your question is leaky butt, which you may be referring to as diarrhea. Is that celiac? No, celiac can certainly cause leaky gut and leaky butt, but celiac is a defined condition where there is a allergy, a true allergy, IgM and IgG and IgA. Those are just antibodies. There's a true um, there's a true allergy to gluten and gliadin and certain proteins found in grains, most commonly wheat products, but there are other gluten containing grains. That's celiac. And what happens in celiac is some of the micro proteins found in gluten and gliadin, they look very similar to the some of the structures on the microvilli of your small intestinal cells. And so, guess what? Your immune system makes a mistake, and not only is it attacking the protein of the gluten and gliadin, it also starts to attack your own intestines, and not just attack them, but destroy them. And the lining of the intestines of a true celiac patient is uh, horribly inflamed, and most of the absorptive capacity is affected negatively. And it's not until you remove gluten and gliadin entirely from the diet can that gut begin to heal itself. Uh, so, a place for you to start is either something called an elimination challenge diet, where you're eliminating certain suspected foods from your diet for a week or two, and then one by one reintroducing them into your diet, trying to basically cause yourself symptoms or cause yourself to have a bad day. And if you suspect celiac disease, there are standard tests that can be run. They're blood tests. They're basically looking for antibodies against gluten gliadin and also antibodies against your small intestinal cells, transaminase, and a couple of others. But the diagnosis of celiac is really straightforward. You can go to most primary care providers and get that diagnosed if you suspect that that might be going on. Are these supplements safe with Ditalizim and Eliquis? I'm not sure which supplements you're referring to in particular. Um, so just says, are these supplements safe? So the methylators, certainly the B vitamins would be safe. The NMN and TMG, that would be safe. Um, what what I will say about the Eliquis, the other medication I'm not concerned about. What I would be concerned about the Eliquis. Eliquis is an anticoagulant medication, and some of these herbs have anticoagulant activity. And so we would just want to make sure that if you go on adaptogen herbs or herbs like curcumin and black seed and ginger, that your blood isn't becoming too thin, so that you cannot stop a bleed. And so, excuse me, the best way to do that is, I assume if you're on Eliquis, you're having some bleeding times monitored by your doctor. If not, you should be. Have a baseline, and then one by one introduce these other agents, to see if the introduction of those agents uh, is allowable within the normal range of prothrombin time and bleeding time. So that would be something that you would just have to work with a practitioner, such as myself or your primary care provider. The other medication I'm not concerned about, but the Eliquis, you just have to be careful that you can stop a bleed should you scratch yourself or cut yourself. Oh, let's see here. What heals leaky gut, Dr. Shelton? Okay, good question. So the first thing we have to consider is any aggravating factors, removing aggravating factors from your diet. Because if you're still consuming triggers, then it's going to be very hard to heal that gut and to stop the inflammation that's going on. So, the first piece of that is to discover which foods uh, or drinks you might be sensitive to or even allergic to. And there are a few methods to try to make that discovery. One, I think I mentioned earlier, is something called elimination challenge, where you would basically go on a hypo allergenic diet, so a low allergen sensitive diet. And then one by one, you reintroduce the foods, trying to cause yourself symptoms. And those symptoms can manifest not just in the GI tract, but they can manifest with energy levels, with brain fog, on the skin, with mood. So it really kind of depends, and it's variable on between one patient and the next. The other option is to get a food allergy panel. Most panels are pretty extensive. They include 96, 97 different foods, for instance. And you're not looking for all of the antibodies. Most commonly, you're looking for IgG, which is more chronic exposure. Uh, but it is extensive and it looks at a variety of different foods to see if you might be sensitive to. So the first piece of that is to eliminate those sensitivities, and then we can start to add in things to help heal the gut. Zinc has been wonderful for that. Glutamine has been wonderful for that as well. Making sure that your microbiome is restored. Some people have benefit through taking digestive enzymes before meals, so at least containing amylase, protease, and lipase to digest carbohydrate, protein, and fat. Some individuals, not only with the digestive enzymes, have benefit, but also adding in hydrochloric acid, so a little low dose of acid to help break down the foods in the stomach so that by the time they get to the large intestine, they're less likely to cause triggers and inflammation in the gut. And then some people do well with mucilaginous herbs such as slippery elm and marshmallow root. There are a number of others too. So that's kind of an initial how to heal the leaky gut. More times than not, it's more complicated than that, but that's my initial advice, my initial general advice for you. What type of magnesium is best for chronic fatigue syndrome? I have found magnesium L-threonate. I think that's spelled so magnesium dash the letter L dash threonate. That's spelled Threonate. Magnesium L-threonate. It tends to be kind of a pricier form of magnesium for sure, but that form tends to have uh, the biggest clinical effect. And I would say that the second favorite would be magnesium glycinate, glycinate, depending on which part of the which side of the pond that you're on, glycinate or glycinate. Okay, I'm still with you here. I'm just shifting back to another page. Um, okay. Next question. Does LDN help with chronic fatigue syndrome? It can in some patients. LDN is low dose naltrexone. It doesn't help everyone, but if you've tried everything else that I've been talking about for chronic fatigue, it's certainly worth a try to do low dose naltrexone. And for naltrexone, I would recommend a taper. So most individuals start pretty low, maybe 25 milligrams a day, and then do that for a week or two, and then maybe you can jump up to 50 for a week or two, and then the same pattern going forward. But I would recommend that you start with a low dose and then taper up from there. All right, just a few more minutes here. Try to get to a couple more questions. GERD or reflux from COVID feels like I can't feel my swallow or it dry or burns. Yes. So muscles are affected throughout the body, both in chronic fatigue and post COVID and post vax. And so muscles are affected. And we don't just have these muscles, right? We also have the heart, and a very important muscle, but also the esophagus is a muscle. And so in fact your entire digestive system is wrapped with muscles that squeeze hopefully food from here all the way out, and along the way they do a lot of neat things, but yes, your esophagus can be affected because it's a muscle, and that's a common occurrence in chronic fatigue syndrome patients and post-COVID patients. Just a difficulty swallowing, heartburn is more common. The entire digestive tract is affected, not only due to inflammation, because but also because of some of these muscle issues. Mucus in my throat, but nothing is there. That may be related to that might be related to postnasal drip. It can also be related to poorly functioning esophagus, taking a PPI, which is a proton pump inhibitor, been doing natural protein, gut renewal. Will this ever go away? I also have pulsatile tinnitus in my right ear. Yes, also common in post COVID. So, what I would recommend for you to do is maybe address your mitochondrial health, address your hyperactive inflammatory response, those reactive oxygenated species, and look at your hormones closely. If we get to the root, which is usually hanging around those three things in both chronic fatigue and post COVID, if we get to the root and begin to correct the hormonal imbalances, the digestive health, the inflammatory markers, the hypercoagulation, the reactive oxygenated species, then we can start to see improvements in the entire system. That's my recommendation, rather than just trying to treat each individual symptom with a unique medication, prescription medication, because then you're taking five or six different medications for five or six different symptoms. When if you got to the root cause, you could really start to see positive progress on all of those symptoms. So, yes, it can go away. I would recommend that you make an appointment with a functional medicine doctor either through our website or through a local provider. Okay, I think I have time for one more question. Okay, been feeling better with green juice concoction. Great. Just worried about creating potential food sensitivities. Is it a safe protocol as lifestyle or better for periodic supplementation? So, that's pretty vague, first of all, and I can't address your question specifically. Green juice concoction is great to take long term and ongoingly, but I refer you back to the protein intake as well. So, people with chronic fatigue, people with post COVID symptoms, they tend to do better on not just a whole foods diet rich in fruits and veggies, nuts and seeds, beans, legumes, whole grains, and adequate amounts of protein. I'm sorry, all of those whole foods, they do better on adequate amounts of protein. So again, that formula is zero point 0.8 grams per kilogram body weight. Try to make sure that you're getting that in. And as long as you're getting in that protein each and every day, then taking a veggie green juice concoction ongoingly is safe as a lifestyle. We just want to make sure that you're eating real, whole, nutrient dense food as well. One more question. Are digestive enzymes enough to restore gut microbiome? So, those are two very different things. Microbiome are bacteria, they're probiotics, they're healthy bacteria that live mostly in the large intestine, but also in the small intestine. Those are bacteria, those are living organisms. Enzymes, digestive enzymes, are compounds that basically you can think of them as like Pac-Man. Do you remember the arcade game Pac-Man? Enzymes are basically uh, compounds that chomp down food into smaller, absorbable units. So they break down protein into constituent amino acids. They break down starches into simple carbohydrates, and they break down fat particles into smaller liposeals that you can actually absorb. So those are two very different things. The enzymes break down the micronutrients. I'm sorry. The digestive enzymes break down the macronutrients, the proteins, the carbohydrates, the fats, so that the micronutrients can be better absorbed. So the units of the macronutrients, as well as the vitamins and minerals. And that's totally separate than those bacteria or those the the probiotics that inoculate and live in your digestive tract. So I think that's all we've got time for today. Hopefully this was helpful. And again, I'm not equating the two. I'm not equating chronic fatigue with post COVID or post vax, but there are striking similarities between the two. And I've been doing this for 20 years and helped lots of patients with chronic fatigue, and it's very translatable for post COVID patients, chronic fatigue, just because there are so many similarities. So thanks for your questions. If you have others, please leave them, and someone on the team will put them on the list, and we'll get to them next week. Please join us next week, where I will be back, same time, same day, and I think the discussion next week is going to be on mold toxicity, which is important for post-COVID patients because your immune systems are caught up in trying to fight the devastation that COVID caused. And so you are more likely to have some sensitivities to mold toxicity and mycotoxins. So please join us next week, and we will get into the mold. I hope you have a great week, everyone. Thanks for joining me, and take care.